Good evening, everybody. Thank you for joining us for the 8th episode of Surviving, Living, and Thriving During COVID-19. Today's episode, we will focus specifically on COVID-19. When the pandemic began to hit, it was initially called an epidemic, some kind of virus or advanced flu that was over in Wuhan, China. Then it began to spread. It emerged in Europe, appeared to skip over Africa, and at a later date, it hit Washington State. Here on the East Coast, we watched on, and we still felt somewhat removed. However, within weeks, the queens of the East Coast, New York and DC, became epicenters. In these early days, rumors began to spread that Black folks weren't getting it. We also heard that this was something that only people over 60 could get. Only they were most at risk. But again, things changed. People of all ages and races were falling ill. Some were otherwise healthy, with no pre-existing conditions. And while it did not discriminate, the numbers in the Navajo and African American communities grew larger than anywhere else. There has been a lot of misinformation and evolving information across the board, much of which was costly. But after months of stay-at-home orders, some cities began to see plateaus or even drops. And then with the reopenings across the country, Memorial Day, packed beaches, restaurant reopenings, and necessary protesting, we are now seeing spikes once again. So what's the update? Today, let's find out what's going on, what we need to know, and how to protect ourselves and our loved ones moving forward. I would like to start by introducing our first guest, Dr. Garrick Baskerville, who is the owner and founder of MetsiCare in Austin, Texas. While Dr. Baskerville serves all patients, he focuses on those in the service industry, particularly artists. When COVID-19 hit, he transformed his clinic into a testing site. Thank you for joining us tonight, Dr. Baskerville. Are you there? There you are. Okay, I think you need to go ahead and unmute yourself, though.
Hello, how are you?
There we go. Good, how are you doing?
I'm doing great.
Good, thank you. Yes, thank you for being here. Thank you for being here, I really appreciate it. So can you tell us a bit about how this pandemic has hit your community and what your experience has been with testing?
Yes, so I'm in the community of Austin, Texas. I'm from Philadelphia. I now live in Austin, Texas, and I'm happy to serve our community here. As far as in Austin, you know, we haven't had the crazy numbers that other states or other regions have had, other cities. So we are still in the low thousands as far as the number of people in Austin, Texas that have been affected. Although the state of Texas is actually seeing, we're the second largest state right now as far as new cases per day. So those, you know, that's a little concerning for the state of Texas. But currently, you know, the numbers in Austin are still fairly low, which is good. The people here seem to still take concern for the virus. We're wearing masks in indoors. If you have to go indoors, masks are mostly required. There's some indoor places, some grocery stores that have now made it optional. I think because they've heard some opposition of people saying that they didn't want to wear a mask, unfortunately. You know, so, and then we have outdoor areas like parks that are open. They are in limited capacity. We have water areas where we have streams and lakes. Some of those public areas, you have to have a pass and reserve them ahead of time, so you can't just go and use it and pack in like we used to. And then the restaurants are I believe that we're still at 25% capacity as far as being indoors. then that's the capacity. So, we are taking restrictions and trying to be preventative with this virus. But unfortunately, there's still a lot of people here, even in Austin, they're acting like the virus went away. Marita, I couldn't hear you.
Okay, I can hear you. I thought I lost you for a second. Okay. Yeah, I think as far as people, it seems like, and I am wondering if I'm on, okay, I'm keeping gallery view for now. So yeah, I mean, I think that's something we're seeing nationwide, is that people are pretending like the virus is not real, which with the way that it's traveling, you would just imagine that even if Austin's not being hit very hard right now, you would think that those numbers are at risk of climbing, especially given that the numbers are climbing in other parts of Austin. Have you done a lot of testing in your clinic, or how's that been?
Yeah, so I've done the PCR testing with nasal swabs, and I've done antibody testing. Of the tests that I've done, I actually have not had anyone show up positive for the coronavirus.
Wow. Okay.
Which it has. I think that has to do with the prevalence of the disease, COVID-19, and specifically Austin is still fairly low. It doesn't mean it's not here, but just of the small sample size that I tested, no one has had positive. And then I've done antibody testing as well, and I just had one person show up positive for antibodies to COVID. So
okay, I want to delve into that a little bit further, but let's go ahead and bring Dr. Ikegwuoha on. So Dr. Benita Ikegwuoha, she's a doctor of nursing practice in Arizona. Are you there? You can go ahead and share your camera for us.
Yes, I am. Sorry.
All right. How are you doing today?
I'm good. You?
Good. I'm doing very well. Thank you for joining us today.
Yeah, definitely.
Now, when this pandemic hit, you were actually in West Africa. Can you tell us about what was going on there? How are things now, and how it was for you when you were coming back into the US?
Yeah, yes. So when I was there, I originally went when it was just kind of, you heard about the coronavirus, and I was there during the peak when everything started ramping up. And I felt they were more prepared than United States. And I think one of the things that enabled them to be more prepared is because they've been exposed to other pandemics like the Ebola virus. So they have education and awareness of being prepared. For example, a lot of the restaurants we went to before even the onset of it or the peak of the coronavirus, we had to wash our hands outside before we went into the restaurants. There were space seatings ahead of time. And even one of the hotels we stayed at, a very small town, they would actually check your temperature before you went into the hotel. And every single time you left the hotel and came back in, you were required to take a temperature. And then they also required you to wash your hands. So I felt the fact that they've been exposed to something similar, they were more prepared. And then I remember us having to come back into the US, and we got to the airport, and in the airline, we filled out a lot of paperwork, just screening for coronavirus, and nobody took it from us at all at the airport. I was not questioned, and I was traveling with a couple people. We were not questioned. Nobody asked us anything about it. And this was the point that most of the states were closed. So there were nobody on the road, just a few people. But the fact that you can't come through an international airport from an international travel, even though most people flew through Europe, which had more cases than the United States at that point, but nobody asked us any questions about anything, symptoms, where you've been, or anything like that. So it was kind of very surprising. I did have somebody get questioned by the CDC who were there at the airport, and they just only asked them one question: where did you fly from? And they told them where they were, and that was it. They were like, okay, you're good to go. Did not even check their temperature. So I just felt they were not prepared at all.
Yeah, that's what I've heard from other people who are coming from outside of the country as well. So yeah, unfortunately. Okay, you guys. So today, let's go ahead and start with what kind of threat COVID-19 is currently. While we are seeing that it doesn't appear to discriminate, by and large, we are seeing people who may be overweight, have pre-existing conditions, high levels of exposure, or who are over 60. So for, say, my brother and I, both of us eat healthy, we both are very active and lean, we have no pre-existing conditions. Do we need to be as concerned about getting sick as long as we limit the number of people we are around, wash our hands, and stay out of high-risk places like hospitals, for example?
Yeah, I can start with that question. I think we all still need to be cautious, regardless of the category that we're in. And of course, you did mention some of the categories. I mean, most of the cases that we've had are actually in the over actually 65-year-old population. Approximately 80% of the cases that led to hospitalization and death in that category, 80% of them are over 65 or older. And then also the people that are affected tend to have some kind of chronic condition, whether that, and you named obesity, but also hypertension, chronic heart disease, chronic lung disease like COPD or asthma, hypertension. Those are some of the biggest chronic diseases that people have that puts them in that category. And then there's also some data that's looking like vitamin D deficiency is playing a role in this as well. So darker skinned individuals tend to be more prone to have vitamin D deficiency. Also during the winter months, more prone to have vitamin D deficiency. And we're not going to be there for a while, but we may be there when we have a second surge of this, which we're expected to in the fall or winter. We might have another surge of corona, and vitamin D, like I said, might play a role in that. So there are the more higher risk demographic that you need to be worried about. But unfortunately, we know that it's also affecting kids and healthy people and healthy young adults, and even people in those categories have actually passed away. So, I know you and your brother Chris are both very healthy, and you're into fitness and exercise and nutrition, both of you, but also it doesn't fully take you out of the risk. So, we can't say that you have zero risk if you're healthy and you exercise and whatever, So I think we all still need to be precautious, and the best way that I believe we can do that is to continue to follow the recommendations of hand washing, social distancing, and wearing a mask, especially if you're indoors.
Yeah, the vitamin D one, I was hearing about that recently too, which is really interesting. And actually my vitamin D that's something I've had to take a supplement for. It's been low for years, and it kind of goes up and then goes back down. And the thing is that I could imagine some people might be spending more time outside, but some of us, especially if you live in an apartment building or a condo building, it's more of a stress to go outside. So you end up staying inside more because you're like, if I go outside, I either gotta have to deal with elevators and staircases and everything else. So even with the sunlight coming out, I would imagine that a lot of people are gonna have to deal with low vitamin D just because they're not outside as frequently as they normally would be.
And I think that even ties into the fact he said the low vitamin D and the fact that a lot of people are staying inside. And there are studies that show there is a correlation between low vitamin D and depression. So you already have people who are inside and not able to have like the social interaction or their creative outlets because of the fact that they're indoors, coupled with the fact that they're already not exposed to the vitamin D, they would absorb through sunlight. And then there's that risk of increased depression as well. And so it just compounds a lot of other things in most population. And of course, the fact that some of them are, especially people of color, are a little bit hesitant to go seek help, especially when it comes to mental illness. And then the fact that there is also limited people to see because of the whole social distancing makes it worse. So.
Okay, now I think one of the hardest things about this virus too is that that if you have it, you can have it and be asymptomatic and still pass it on to other people. And these other people can be more vulnerable than you and therefore more symptomatic. Can you tell us more about this?
So definitely, there are a lot of people that are asymptomatic just because everybody has different immune systems. So some of us are better equipped with better immune system that we're able to fight off a virus without really showing any symptoms. And that's what we mean by being asymptomatic, that you don't exhibit the symptoms you would normally exhibit if you come in encounter with any virus. And so we can be asymptomatic, but then that doesn't make it that when you're maybe within a person that is in a vulnerable population, like we talked about, anybody with any respiratory issues or obesity, hypertension, they're more likely to get exposed to it and will show symptoms. So that's why we also encourage people, yes, you might be healthy and you don't have any symptoms. Doesn't mean you shouldn't protect other people, because you might not show the symptoms, but you carry the virus, but you can pass it on to other people who are especially vulnerable. And that's what we see in a lot of population, where there are people that live in a household, there are multiple people in a household. You can have a young person who's very healthy, maybe they come in contact with the virus and they're asymptomatic, but they can pass it to their grandma or grandpa or any other person who's at high risk in that home.
Yeah, and I think, I was talking to someone earlier, and the thing is that it's almost an arrogance that people have to think like, well, I'm not at risk, so I'm just going to go about my day, do what I want to do, not wear a mask. And, I want to step out and say, like, I almost wonder if that is, just kind of the arrogance and selfishness that is so prevalent in the US, and I wonder if that it might be even particularly unique to us as Americans, to the fact that these other countries are faring better than we are.
Yeah, Marita, you make a good point. I think a lot of it does have to go back to cultural, the culture of Americans. Americans might not necessarily want to be told what to do. They want freedom, and the freedom is really on the personal, on the me side instead of the you side. And so instead of thinking about the freedoms of other ones to be in a healthy environment, someone's thinking about the freedom of themselves not needing to wear the mask. And I agree with you. I think that's very selfish. It's not hard to put on a mask. We've done other things to protect ourselves and others, whether it's following the law with a speed limit, or wearing your seatbelt, or getting your car inspected, to make sure it's safe to take on the road. These are all things that are in the law for us to do, and we follow them. So I don't know why we can't wear a mask when we go out in public, when we're in indoors or in other close communities. So I do think it's an arrogance of the United States. And so as far as trying to, and then the other part, I guess that I wanted to make a point of is, I think we really don't have a good understanding as far as Americans as a whole. I feel our health literacy is low. I believe in other countries, their health literacy is higher because it has to be, specifically in Africa and in Asia. And I'm including India in there as well. Their health literacy has to be higher because some of the diseases that go through Africa and Asia are much more likely to kill them. And so I believe that they are much more understanding of what it means to protect yourself and others. Here in the United States, I think we have this mentality that there's a drug or a way to fix everything, or that we have the best healthcare system in the United States, which actually the data shows everything against that. We are ranked in the 30s. The data changes year to year, but we're in the either high 29s or the low 29s or high 30s as far as ranking in the United States. So we do not have the best healthcare system in the world, but we spend more than double of what the next healthcare system does in the world. So I believe that it is an arrogance, and I really don't know how to correct that. That we already saw in Michigan and other states, people stormed the Capitol and They brought guns to protest against wearing a mask, you know? So it's kind of sad that people don't want to look at the bigger picture of protecting all of us, because if we all wore a mask, we could have opened up the economy a long time ago. And if people worried about the economy, we could have brought it back a long time ago if we were all protected. But we had this arrogance that we didn't want to, when we just wanted to see the numbers fall, which in some states, they are falsely falling because they're not testing anymore. You know, like in Florida, you know, so one of my best friends is a physician in Florida, and he told me his hospital's not testing anymore. Why are they not testing? Because they don't want to know the numbers. They want it to falsely look like it's great, so everyone can enjoy the beaches and everything. Meanwhile, my friend is seeing record numbers of COVID in his hospital.
That's crazy. That's crazy. We're gonna come back to that, but yeah, that's crazy. And like, you know, and just one last thing is that, you know, several episodes ago, we talked about like the me generation and how the millennials and the baby boomers actually coined the me generation. And if we're going to be able to move out of that, which I think, you know, given like the spirit of the protest, we are in many ways moving out of there, but we'll see how these next chapters evolve. But one thing I want to talk about is the surfaces. That's something that there's been a lot of talk about, and recently I heard that the virus can't survive as long as surfaces as originally thought. Is that true, or what can you guys tell us about that? You guys both there? Okay.
Yeah, so most data they're showing it's saying it can't live on surfaces, and it's just like some viruses can, and some viruses can travel through surfaces like the flu. It's all contact, but there's just kind of mixed data. Yes, it's not something that you get from touching like a table or the doors, but it's still there's always that possibility, and it's like a lot of research are being done in such a haste that it's not as detailed as we want it to be, because mostly they're finding out it's more of a close proximity contact where you're having like a respiratory contact with somebody else, like either talking to a person within less than the 6 feet, 3 feet, 2 feet. And I know there was a recent data that came out saying that most people, there's a higher percentage when you're in a closer proximity to a person versus when you are far away. And like we talked about, is the prolonged length of exposure that you have increases your risk of getting COVID-19. So you can come in contact with somebody for a few seconds. That doesn't necessarily mean you will get it. But if you have repeated exposure to that person, it increases your chances of getting it.
Okay, yes, and that's interesting to me too. I was speaking to both of you guys about that a couple nights ago, and that's pretty interesting. So it's really. And is it safe to say that you either have to have a very strong exposure? So for example, someone who's working in a hospital, which probably has multiple people that they're exposed to at that point, but is it safe to say that that you need multiple exposure episodes in order to contract the virus? Is that fair to say?
Marita, you know, that's a good question. You know, I think the biggest thing for the listeners to take home here is the chances of getting the COVID-19 virus is actually, it's the viral load, or which is the amount of virus that you're receiving over what time period. Okay, so, you know, it could be an hour. Let's say you're in a restaurant and the air is circulating or whatever, but there's still COVID-19 in that restaurant. You're in there for an hour, but you're exposed to a little bit over an hour. That could add up to the threshold where you're actually going to be symptomatic and get the disease COVID-19. But if you are, let's say, on a trail outside and the virus is able to spread out in the air and it's not forced in your face, and you walk past someone who's unmasked and you're unmasked and you just go by them, you know, you're very highly unlikely to get the disease unless they have it and they sneeze directly in your face. I mean, you know, because it's a very, very little bit of a virus over a very short period of time, just that little bit of time that it takes for you to cross their path. So a little bit of virus over a short period of time, very unlikely to get COVID. A lot of virus over a short period of time, it's very possible that you get COVID. A little bit of a virus over a long period of time, also possible to get COVID-19.
Okay, that's really helpful. I feel like I can be a little more comfortable leaving my apartment then.
Especially if you have a mask on.
Okay,
Yes,
all right.
that does not negate you actually still taking the measures you need to take to protect not just yourself, but other people.
No, of course. It's just that literally I've been, just kind of like I try to limit how many times I'm going out, and that whenever I go out, I'm maximizing that time. In terms of like if I'm going out, like, maybe I go to the grocery store and I grab my mail and go for a run, something, I try to do a few things at once. But just going down the hallway and down the stairs, I was concerned about that. And if there's, I don't know who was passing through before I passed through. So that's helpful.
Marita, you're likely going to be safe walking through the hallways and everything, especially, like I said, if you have a mask. I do want to just clarify one point, because I don't want people to think that they won't get COVID if they touch surfaces. Even though we might not have good studies to prove that someone got COVID-19 from a specific surface, because I don't believe that we do have that data, it is still a possibility. So we still know that COVID can live on surfaces for hours to days, okay, depending on what the surface is. It still can live there. So I don't want people to think that it's still not important to wash their hands. It's after they touch surfaces or whatever, not touch their face, especially their eyes or their mouth, without washing the hands. Because if let's say they touch a doorknob, let's say to a restaurant, and someone else just touched it with COVID, and then they touch their face or their eye, they could potentially get it. Unfortunately, we're only a couple months into this thing, so we don't have the best data, and we can't necessarily trust data from China. So we have to compile the data here in the United States and look at it over a longer period of time. I believe we'll know better statistics in a couple months, if the government allows that information to come out. But I believe we potentially could have better data. But, I think for now, we just have to take the precaution to continuously wash our hands and be vigilant with all the other things that we know about to help stop the spread of this.
Okay. So what are we seeing from those who are recovering? I would assume that these are generally healthier, younger individuals, correct? And that you can tell, and what can you tell us about the long-term effects, even if you do recover? I remember reading about folks having permanent damage to their lungs.
So from what I've seen, there's both people different. It's elderly, young people, kids, anybody has the possibility of recovery. Yes, you do see it a little bit more in people that are much younger and healthier, just because they have that boost of immune system. Just with any other viruses, elderly and children are always at higher risk of like complications when they're exposed to that. But you do see recovery you've seen recovery in a 90-plus-year-old patient. You see recovery in a pediatric patient or a young patient. And some do have some complications, but it's one of those things like we're still trying to find out, because a lot of people, their recovery time is not long enough for you to see the side effect or the complications that they would get. Some you do see some complication. Some of them are like a physical manifestation, or a lot of them I've seen in my clinic, it's more mental complication, just because of that traumatic experience of being in the hospital, not having their loved ones around, because there were a lot of hospitals did not have any visitation. Your family was not allowed to be there, or knowing about somebody who went through the same experience, or even people in the hospital that they were with that didn't make it and they made it. So it's that guilt is, why did I make it through this whole pandemic? And the person next to me, probably the same age, did not make it. So for my case, I just see more mental health part of the complication from COVID. I don't know if Garrick has a different patient population or complication he's seen.
Yeah, I mean, of course, you're higher risk for complications when you're elderly, or Black or Hispanic. Unfortunately, those are the those are the statistics there. You know, I don't have a whole lot more to add than that.
Okay. Okay. So yeah, I mean, I think, leaning in towards, who's more vulnerable. I mean, yes, this is something we're seeing more in the Black and Indigenous, Latino communities. However, I don't, I'm always kind of bothered by the language around that, because it's not that we're inherently more at risk. It's that the conditions that we're exposed to put us more at risk. So I just wanted to add that to that, because I think that's important to note, especially since, Mr. Orange got up there and said, we have no idea why this is happening. This is such a tragedy. And it's like, we know why this is happening. It's the same reasons why a lot of things have been happening for years. But I do want to go on to what do we know about treatment and reducing any kind of permanent damage? And are recovery rates increasing? Are we seeing that at all?
Yeah, as far as treatment, I guess it would depend on where you are in the disease state. I mean, there's different treatments that look likely that they're better used for certain stages of the disease state. So as far as earlier in the disease state, it's definitely looking like, vitamin C, zinc, and vitamin D supplementation could be not only preventative, but also possibly a form of treatment. And they're using zinc and vitamin C as treatment, along with hydroxychloroquine and also azithromycin. Now, there's mixed data on hydroxychloroquine. I don't believe that we have consensus at all in medicine as far as if it's working or not. There's some hospitals that are absolutely saying they're not doing it anymore, because there was some people that looked like they had higher death rates from using that drug. But also it seemed like they were using it later in the stage. So some doctors are asking, well, what if we use it earlier in the stage? Maybe that's going to be helpful. Right now, we don't have the data to support that either, but it's a possibility. Maybe it will help. So that's that one. Azithromycin does seem like it's having a benefit. So that's definitely useful. As far as later in the stage, there's a drug that's called remdesivir, and remdesivir is looking like it is effective in treating the coronavirus even later in the later stages. So this drug looks like it's much more hopeful than hydroxychloroquine as far as treating COVID-19. And then there's some question about whether curcutin may help fight the disease. We don't have good data on that, but it's looking like that might be one of the medicines that might help. So those are just some of the things. Now, there's other immune boosters that people might take, like a lot of garlic or ginger or turmeric or elderberry syrup. I've spoken to other doctors, and there's some concern that potentially they might not actually help, but might make your body more at risk for what we call cytokine storm, which is basically an hyper reaction to the virus. So, and this has not been supported by data yet. It's a theoretical risk that it could potentially lead to this. So, I have not recommended those methods to my patients, but I have recommended, as far as in prevention or people that get sick, to take vitamin C, zinc, and vitamin D, because we haven't seen the same risk as far as cytokine storm, or basically your body having a hyper inflammatory immune response.
And you said that's with the garlic? And the turmeric and the elderberry?
Well, potentially other immune boosters.
Okay.
I just use them as an example, but immune boosters outside of the ones that I talked about, vitamin C, vitamin D, and zinc. Outside of that, there's potentially a theoretical risk of a cytokine storm, which is basically the people that are dying from COVID, and they wind up getting what's called ARDS, which is a pneumonia. It's basically your lungs are filled with fluid, and these are the people that wind up on ventilators. So I guess we just, the point I'm trying to make is we might be taking some medications over the counter that we think might be helping our immune system, but it may not help, and it might prime your immune system to overreact to the coronavirus. But again, this has to be studied more. It has not been studied. I just want to pass on my understanding of some of these immune boosters and how they may potentially be harmful. But again, we can't say for sure because we just don't have the data.
And I think one thing that you said that's really important is that there seems to be more options and more success when they're treated earlier in the stage than later on, which I think we can say for most conditions. But I think that's important, especially since people are very hesitant to go and get care right now for a lot of reasons, because they don't want to be exposed to other people, and they don't want to be away from their loved ones. I think there's a rack of reasons we could go through. What would you say in terms of when do you think it's a good time to be like, okay, you really need to go to the ER? Or, and I know you can be screened, you can call and stuff, but can you give us some backgrounds, like when's a good time? Like, okay, your symptoms are pretty severe. Like you need to take the risk to go to the clinic to get tested, which can be, depending on where you are, especially, can be a risky situation, going into the clinic with other sick people. What are some kind of key symptoms that, like, okay, you have what might be a pretty severe case, or severe enough, I would say?
That's a good question, and thank you for asking it. So I would say there's a list, and I'll try to go through them. Number one, the biggest is if you can't eat or drink. Obviously, those are things that are necessary for survival. So if you can't hold down food, if you're not able to eat, if your throat hurts too much, if you have too bad of a headache, if you're so nauseous, or if you're having crazy diarrhea, because this virus can cause diarrhea, you're not able to sustain life that way, so you're going to need to go to the emergency department. That's number one. I would say number two, if you cannot get control of your temperature, so if you have continued prolonged fever, and I would say a fever over 102 point something, whatever that something is, but over 102 point something, if you're not able to sustain a temperature lower than that, or get the temperature to go down, then you obviously should not be still at home. And then other concerning things that may not be COVID, but you could have it, is actually if you have a stiff neck or severe neck pain, along with a headache, that's a symptom of meningitis. And it's really important to understand that just because we're in a coronavirus pandemic doesn't mean other things can't happen. So not every illness is going to be coronavirus. So I think it's very important for people, if you have a severe headache, or you have a stiff neck, you can't move your neck, or you have severe back pain, you have to go to the hospital, because that could be meningitis. The next would be if you're extremely short of breath. So if you can't breathe, if you're feeling winded, if you are noticing your respiratory rate is increasing, where you're breathing more heavily, or you notice your body's using extra muscles that you wouldn't normally use, or if you see your stomach going in and out to help you breathe, not a good sign. You need to call 911 and go to the hospital. Now, it's great if you have a device. One of the finger devices called a pulse oximeter. Those measure your level of oxygen. And so if your oxygen is able to stay over 94% at rest, or 92% with moving, then you're safe to be at home. But if it drops below 92%, if you take a step or you walk a short distance, that's another situation where you should actually be in the hospital.
Yeah, and I would add also, just if you have chest pain or numbness and tingling radiating to any parts of your body, or loss of bowel and bladder. So those have nausea. Definitely, I do agree with, like, if you're not having
Dr. Ikegwuoha,
yes.
could you back this a little bit? Because we missed part of what you were saying. At least I did. I don't know if Dr. Baskerville, did you have that loss in audio for a second too?
I did, yeah.
Okay. Yeah, if you
Sorry,
could scroll, it's okay, no worries. Just if you could scroll back, I just want to make sure we don't miss that part that you said.
Yeah, no, I was saying, for example, people with chest pain, or because yes, people can think chest pain can manifest. It could be anxiety, or it could be pain, or it could be acid reflux. So if you do have chest pain, because it manifests different in women and men, if you have chest pain with numbness or tingling that radiates to your arm, please go to the emergency room, because we're seeing a lot of cases of patients in the emergency room that are taking days to come, because not only are they afraid of going to the ER, but they're afraid of getting COVID-19. So definitely, if you have any symptoms that is out of the ordinary, and especially those who have already chronic condition that are worsened, your blood sugar is severely elevated over 300, 350, and you're usually in the low range. If you're asthmatic and your inhaler is not working, no matter how much you've used it and you're feeling sure. So anything that you've had, please go to the hospital, because we are seeing patients that, like we had a patient, chest pain, numbness and tingling, and definitely didn't show up to the emergency room until a couple days later. Or we've had a patient who had the worst headache. If you have the worst headache of your life, please go to the emergency room. That could be a sign of stroke, because
your audio, we're having trouble with your audio again.
Is it any better?
But right now we can hear you, yes.
Okay. So yeah, if you're having the worst headache of your life, please go to the emergency room, because it could be a sign of a stroke. Because one of the things, especially vulnerable population, is they have hypertension and they think they would have symptoms. And sometimes you don't have symptoms, but sometimes you do have symptoms, which is the warning sign you're having a headache and it's the worst headache of your life. Go to the emergency room, because we ended up having a patient with a stroke, and she ended up coming in 3 to 4 days later and now has paralysis to one side. And it's something that could have probably been prevented if she came the day of the symptoms. So like he said, the same exact thing. Definitely, if you're not able to keep fluids down, or especially fluids, because you need that for sustenance, please go to the emergency room, especially also with people that are pregnant. You're not able to keep fluid down, or you have what's called hyperemesis gravidum, where you continuously throw up and no matter what, you can't keep food down. Go to the emergency room, because you're going to need IV hydration. So those are the things. But if you're already vulnerable and your symptoms are more severe than it used to be and you can't see a primary care, then definitely go.
Okay, thank you. I want to go ahead and I want to ask you guys about these spikes. Do you think, I want to talk about them generally and get some input from you guys on this, because I have read about some spikes happening, and there's a lot of reasons for those spikes happening. Do you think we're going to have to reverse, and I don't know where everybody is in the country, but for Washington, D.C., Maryland, and Virginia, we're currently in phase 1. And, at some point we're supposed to go into phase 2, obviously. And I'm just wondering if we're even going to make it to phase 2 before reversing out of phase 1. Do you guys have any thoughts on that? What are you guys thinking?
Like, for us, I know in Arizona, we were one of the few people that opened early, and there is a spike in cases now, especially as of yesterday. There is over 1,100 new cases that are just happening. And I think we ended ours at the end of May. And so we're seeing that increase, and also increase of people that are hospitalized for COVID. And then I think also that attributes to the fact that we're doing a lot more testing. Some of the universities locally are actually also engaged in actually testing and finding ways. One of the things that they're doing is actually using a sewage system to test for COVID, because they're noticing that there's some testing they're seeing in the sewage system. And so they're trying to use it to kind of find out what part of the demographic that there is a high rise in COVID cases. But I've noticed a lot of people going out without wearing masks, even just in the hospital setting. it's like employees, you need to wear a mask. And I think for a while when we opened, there was just that people were relaxed. Oh, I'm fine. We're never going to get it. We're not. And I think also there's that assumption that the cases are not as high when you're in an environment that is hot weather like Arizona is, but that's really not truly the case. So I think for us, you're seeing a lot more testing, but you're also seeing people that are not following the recommended precautions that they want them to, that now there is a lot more spike in cases in our state. And so I think this week, even our hospitals are having more meetings to say, okay, we all need to wear a mask the whole time we're in the hospital. It doesn't matter where you are, even if you're walking from one building to another, you should have your mask on. Continue hand hygiene. We're still having to check temperature. Employees can only enter through specific entrance, so they can check their temperature before they come into work. And patients are also being asked to have their temperatures checked, or visitors. And so still having some measures in place, like maybe having only one family member that can come into the hospital. And especially also the fact that we've opened elective surgery. Before it was just emergency surgery. Now there's elective surgery that are available. And we're seeing also cases of people with positive COVID cases coming for elective surgery. So I think it's just making sure things are in place, but there's no way to predict, oh, you opened really fast and that's what's causing the spike, versus people like New York, that it's a little bit flattened because they took more measures. And there's that emphasis, you need to protect others. Even if you don't care about yourself, you need to care about others by putting on your mask, washing your hands.
Okay, sure. So I want to ask you guys a couple more questions, and then we're actually getting a lot of questions in the chat. So if either one of you guys want to kind of start scrolling through those. But I want to know, what about a vaccine? On the flip side of people not being careful, there are some people who are just like, I'm not going anywhere. I'm not doing anything until a vaccine comes out. Do you think we're going to have a vaccine in a reasonable amount of time, though?
Let's hope so. There's several countries, including the United States, that have already started human trials with a vaccine. As far as how long it's going to take from the trial to see if it's safe and then to come out and then mass produce it and then for it to be available to us, it would be very wishful thinking to think if that's going to be in the next 6 months or so. Likely it's going to be longer. So sometime next year. So what do we do till then? That's the biggest question. And in my medical opinion, the best thing for us to do is continue to do what we're doing. Take the precautions. Assume everyone has COVID-19. Wear masks, socially distance. Try to avoid prolonged exposure indoors. Those are the best things that we can do.
And I agree with that, because some vaccine, it takes years. And I have a lot of friends that work in the pharmaceutical department, and it takes years to sometimes develop a vaccine. And it's something we should not be in a hurry to do, because sometimes we don't know what the ramification of the complications are once those vaccines are. So you truly want to study and data that can actually provide you with good evidence and data to back up that. And not only how are we able to look at the fact that we were barely able to have testing available? How are we able to mass produce vaccines so everybody gets it? And how do you decide who gets it? Is it healthcare workers first versus patients, the elderly, pediatric patient? Who makes that decision in the clinic? Because you're going to have an influx of people coming into your health centers or hospital wanting the vaccine. So there is a lot of pieces that need to be in place. So like he said, definitely I would not focus on, okay, let's get the vaccine out as soon as possible. Yes, that would be great, but there has to be a time in getting the data we need to see that it's actually efficient enough to do what it needs to do and be able to mass produce our population.
Okay, thank you. So last question for you guys, and then I want to go ahead and move on to the questions from the audience, which it looks like there's at least 7 comments in there. So I want to know, can you actually build immunity to COVID-19 once you have been exposed? And what exactly is herd immunity, and what are the risks involved with that as well?
As far as can you build an immunity to COVID-19, we don't know. I mean, do we think so? I mean, based on other coronaviruses, Yeah, we can develop immunity to other coronaviruses. So Dr. Fauci and his team, they've said that he believes that we will also develop an immunity to COVID-19. But do we really know? We don't. And if you do have antibodies, or you do develop some form of immunity, we don't know how long that will last. You know what I mean? Like, so when we get immunity to the flu with the flu vaccine, that immunity lasts about 6 months. You know, that's why we try to give it in November to get you through all the way through to May, because we know it lasts about 6 months. We don't know how long having the disease will prevent you from getting it again. It could be 3 months, it could be 4 months, it could be 6 months, it could be a year. We don't know. So there's a lot with the coronavirus we just do not know. And then is to address your question with herd immunity. You know, the scientific experts are saying it would take a long time naturally if we had to wait for coronavirus to go through the system, and then for 60 to 70% of the population to develop immunity. And that's what it takes for you to have herd immunity. 60 to 70% of the population has to have antibodies. And so for that to happen is going to take a very long time, especially, like I said, if you let it naturally go through the United States. It could be years. It's not going to be a matter of a short time. It would take years for 60 to 70% of the people to have antibodies. So for us to get to that 60 to 70%, we need the vaccine. That's the only way that we're going to get anywhere close to having herd immunity. So as far as fall's coming very soon, kids are going to be going back to school, and there's going to have to be big discussions about how can we protect the vulnerable population from these kids who are likely not going to get sick from the virus, but they will spread it back to grandma and grandpa, and they could possibly pass away. So I think that's a big discussion, you know, as far as in the fall, if you have kids. I'm gonna just make a big guess about the future, but I believe that the schools are going to say, look, we're going to accept your kids back into here, but you need to sign this waiver, tell us that your kid will not be around any parent or grandparent that's chronically sick, because that kid could actually kill the parent, you know, or cause severely harm as far as putting them in the hospital. So that's to be determined, but you know, I truly believe that's what it's going to look like in the fall.
Okay, and I'm just scrolling through some of the questions and comments here. What can you say about vaccines? So in terms of people there being a distrust in vaccines, there's been anti-vaxxers, there's been people who've just had a general distrust with the medical system overall. How can you guys speak to that? Is this something that we shouldn't trust? Do we need to put more trust in these vaccines? I mean, what is, or how can, or even this way, like if, you know, when we're looking at all these different vaccines that are available to us, you know, outside of COVID-19, let's say, you know, when we're looking at them, what do we need to look for in terms of saying like, okay, this is a vaccine that may be worthwhile for me to get because of A, B, and C, if that's not too generalized. You know what I mean? Or this other vaccine, I'm like, you know, that maybe I shouldn't get that one. And I'm guessing a lot of it has to do with research.
Definitely. A lot is research, but then also a lot is personal preference. And I feel like there's a lot of misinformation about vaccines. For example, a lot of vaccines, people think there is the correlation between, for example, autism. But more research has been shown that they don't cause autism. But I think some of these vaccines are important because they're tested. For example, you see patients say, well, I don't want the flu shot because I get the flu. But in reality, if they actually got the flu without having the flu shot, there is that possibility their symptoms can be so severe they end up being hospitalized, versus if they get the flu shot, they might have a symptom similar to the flu, but it's not as severe as it would have been if they were exposed to it. Yes, there are different strains, different time of the year, that changes, that it's hard to that's why you notice we're doing it every year. But for example, hepatitis vaccine, that's one of the vaccines that can prevent you from having hepatitis B, because if you look at it, hepatitis B especially healthcare workers at risk for it, and then it can become hepatitis C, can relate to cirrhosis of the liver. And so there's been a lot of studies that have been done for these vaccines to prevent, like measles. rubella, all these vaccines, there are a lot of research that has been behind them that I think you need to do your research. You need to talk to your healthcare providers to provide you with the information about the vaccines, the studies that have been done, the efficacy of the vaccine. And some of them, yes, like we don't have, it doesn't stay in our system for a prolonged length of time. That's why we end up doing titers to see where we are if we're low. For example, varicella, those are one of the ones you would check hepatitis B titer to see if it's declined over time so we can immunize you. Or you're noticing a lot of male and females now having HPV, especially when they become sexually active. There is a vaccine that prevents that. So it's like really doing your research, talking to your healthcare provider, because they do have that knowledge to provide to you what's the best vaccination available to your child. And the earlier you give those vaccines, you build immune system with it, that you are less risk of being exposed to it as you get older. So I say talk to your healthcare provider, get the information you need so you can empower yourself with the information you need to make an informed decision based on your lifestyle, what you want to see for your children, and also thinking about others, because there are a lot of parents that didn't vaccinate their kids with MMR, and then we saw cases in Disney and things like that, and you end up seeing these kids exposing others. So it's one of those things, you have to get all the information you need to make the decision you want.
Okay. And given, everything that's been going on, Memorial Day, the beaches, protests, everything, people, going out, with phase one, being able to go to restaurants, all of that. Can we expect more spikes? Is that pretty much the trajectory that we're on? Is that, can we confidently say we're gonna have spikes? Yes or no? Or maybe?
I would say maybe.
Okay.
I mean, and the reason I'm saying that is, we could of course say it makes sense, that you put all these people together, in a protest or Memorial Day, you would expect to see a spike, and likely that will happen. I mean, but the funny thing about science is it's not always predictable. It's not always predictable, and we don't, there's different variables that play a role in that, the humidity, the temperature, so a lot of these people were out, but it was super hot out. And then a lot of the participants of the protests were actually wearing masks. So, maybe the masks help with spreading, this. So you would expect that we won't see huge numbers. And the other variable too is a lot of the people that are actually running around at the beaches and also protesting, they tend to be of a younger demographic. And we know approximately 25 to 30% of folks will never actually have symptoms. So the people that may have been out there protesting or out for Memorial Day and on a boat or on the beach, they're of the demographic that might not get sick anyway. So we really might not even see the spike, because we wouldn't test. Those people aren't going for testing if they're feeling fine. You know what I'm saying? So there's a bunch of different variables. So that's why it's really hard to say 100%, yeah, we're going to see a spike in 2 to 4 weeks because they were out for Memorial Day.
Right. Right. And I mean, that's what I was noticing too. Yes, it's a lot of young people who are out doing everything. But the thing is, though, is that a lot of these young people still live at home. So they're going home, they have grandparents, they have parents, and just general exposure, maybe they, maybe because of their work or whatever, whoever they're exposing themselves to. I was more concerned about that versus, some of these very, very young people necessarily having symptoms themselves. But.
And I think also because a lot of people are now, those young people are teleworking. So it also decreases those risks because they're at home and not really going to a lot of places. But then, like you said, there are people that live with their grandparents, or there's 5 people in a home or more that, like Dr. Bakersfield said, it's like there's a possibility. It can, it cannot. Or you can have young people that have symptoms and they decide to quarantine themselves at home. There's no way for us to gather that data to put it in. But then also another variable is, what about if the state decides not to test? Or they're not testing a lot of people because they don't want their numbers that high, because they might be they might be looked upon, or they might not get the resources they need, versus a state that tests a lot. So it's just, there's so many things that there's no way to truly say, yes, there's going to be a spike or there isn't going to be a spike. And so, and it's just, we are seeing a lot of people, young people, going out to the beaches, hunting, all kinds of stuff. So it's just one of those
and one thing
we can see.
Sure. And I'm going to go ahead and wrap up here real quick. But, you know, and I think the thing is too, is that way, you know, I would like people to think about what is actually essential. You know what I mean? Do you need to get a haircut? I probably can wait. Could probably figure that out. You know, you could probably do something else. You know, do you need to go have brunch with all your friends? Probably not. You know, and, you know, yes, we all want to see the economy thriving, but as Dr. Baskerville said earlier, had we been more responsible, the economy we might have been able to open everything up a long time ago and be much further along in this process. So thank you, both of you, for being here today. I learned a lot. I really appreciate your expertise here tonight. So thank you so much for joining me. So for our audience and for both of you as well, this is our 8th episode. We have one more episode left before we end the season. I've had a lot of fun putting this show on. I've learned a lot, and it's been a pleasure. And I'm not done with it. This will be season 1. I'll go ahead and take a break and plan on launching season 2 in the fall or late summer. So please stay tuned. And as always, you know, all our episodes are being posted up on the website, fight2befitdc.com. So please, and next week we will be talking, so to wrap everything up for the season finale, we're going to be talking about the environment. Because the truth is, we can talk about all these issues we've talked about in the last eight episodes. We can talk about all these things until we're blue in the face, but if we do not have a safe earth to live on, all of these issues become much less relevant. Much less relevant. So please join us next week, 7:30 p.m. Eastern Daylight Time. You can go to the website, Fight2Be-Fit-DC, and go ahead and register there for the next episode. You'll see that up probably on Sunday or Monday, maybe sooner. But you can go ahead and join my mailing list anytime. All right, thank you for joining us. Have a good night. Be safe, be well. All right, good night.
Thank you.
All right, bye-bye.
Thank you.
All right, thank you.